Common Purpose is a live stream podcast featuring Tim Kelly, a Chattanooga-based businessman and mayoral candidate who loves this city and has made his life here. Beyond the conversation, Common Purpose is a show about elevating the bonds that unite us as a community and resisting the forces that would tear us apart.
Well, welcome to Common Purpose, the podcast about elevating the bonds that unite us here in Chattanooga, Tennessee. I'm Tim Kelly, and today we are tackling a tough issue that's been an ongoing challenge in Chattanooga for years, many, many years, as it has been in many other communities across the country, and that's homelessness, and how we can use better data to make better policy. And I'm thrilled today to be joined by Janna Jahn, who is the director of Fuse here in Hamilton County. It's a really revolutionary program. I think you viewers and listeners will be really intrigued to hear about it. I should say Fuse, for those of you that didn't know, stands for Frequent User Systems Engagement. And I'll let Janna get into that a little bit more.
Be happy to.
Right. So without further ado, Janna, tell us a little bit about, maybe start out just telling us a little bit about how you got here and how you got into this work.
Okay, so I'm from Chattanooga originally. I'm also a returnee, one of those people that left after high school.
God bless you, me too.
You know, couldn't wait to get out, and then finally got smart many decades later and returned to Chattanooga in about the year 2000. Mm-hmm. And I had gotten burned out on a career in management consulting and wanted to do something that would benefit the community. And so I ended up getting a job in local government working for the city of Chattanooga under Mayor Corker's administration. And, going from a business environment, a management consulting environment into government was a real culture shock.
We should talk more about that later.
We can. And I've come to appreciate the value of both perspectives. Mm-hmm. It was actually during my job interview with the city when it was mentioned that we were going to work on homelessness. Mm-hmm. And I guess this is really naive and embarrassing to say, but I actually said, "Oh, do we have homeless people in Chattanooga?" Mm-hmm. That's how uneducated I was. Fortunately, I got hired.
And what year was this?
Oh, gosh. 2003,
okay.
I think.
Mm-hmm.
But fortunately, I got hired anyway and got to learn from the ground up really what homelessness is about. So I had to go through that mind shift of, I've got the stereotypical idea of what homelessness is to learn from people who actually do the work as to what the realities are.
Right.
And I also learned that sort of the conventional ways or conventional thinking about how you help people actually may not be the most effective way to approach it, mm-hmm. and that you really had to kind of flip your mental model on its head to really make progress. And I guess the other thing I learned was you can make progress, and there's a lot more we can do, and we can be accountable, and we can have positive outcomes. So anyway, that was the beginning of my learning journey around homelessness.
And you're still doing it.
And I'm still doing it, yes. Now at the county, yep. under the sheriff's office,
right.
with the Fuse program.
Yeah.
So.
All right, well, that's a great segue. Why don't you tell us more about Fuse?
Okay, so there is a small population of people living on the streets of Chattanooga who have been homeless, many of them for decades. Mm-hmm. They suffer from severe and persistent mental illness, which makes you wonder, how do they even get through the day? Yep. But somehow they do. Unfortunately, what happens is they end up cycling through emergency rooms. They cycle through the jail. They cycle through crisis centers. They bounce around to different organizations who touch them for a brief period of time, patch them up, send them on their way, but they're always back out on the streets.
Sure.
And so it's a tragedy for them. But it turns out that when you look at the data for these folks, they are costing our community a lot of money.
Right.
So, for example, the first 5 people that we enrolled in the Fuse program together accumulated 3,081 days in the Hamilton County Jail in the last 3 years
Holy
alone.
mackerel. Wow.
And at $100 a day, what did we get for our $300,000 plus dollars? These folks are no better.
Right.
And so then you look back at their date of first arrest and you see it comes from the 1980s and 90s
Wow.
for these folks. And so the question is, as a community, we're investing a lot of money and getting absolutely no positive results for these folks. So Fuse says we're going to step in and we're going to create an intervention. We're going to do the one thing that these people need that will provide them with the stability, and that's provide them with permanent supportive housing,
Right.
which means they will have independent apartments, they will have subsidized rent, HUD vouchers, though they will pay a portion of their income towards rent. But the key is these folks, because they're severely and persistently mentally ill, need a very intensive level of support services, mental health treatment and support services, that until Fuse came along was not available in our community.
Right. I've heard so many horror stories about the mentally ill winding up in emergency rooms in particular, which, it's just, you're right. I mean, this is, I love topics where the moral thing to do is also the economically sane thing to do.
Right.
And this is one of those where, the two meet in the middle. I mean, it just makes no
Right.
sense for anybody to keep doing it. And it's kind of hard to imagine. I mean, I think there will be a time when we get to a point, when you guys get more traction with this program, hopefully the model spreads across the country, where we think, how in the world did we ever do it otherwise, right? I mean,
well, it's common
Yeah.
sense
Yeah.
that, and I can give you some specific
Please
examples
do.
of people, but
Yeah.
I mean, it's common sense that everybody does better at home with
Right.
the knowing you have a door to lock, a place to sleep. And for people with severe and persistent mental illness, and we're talking about schizophrenia and bipolar, people who are delusional, hear voices, I just can't imagine what their daily lives on the street might be like. But what we have seen, and I'm thinking of one lady in particular who she'd been homeless on the streets more than a decade. She can't even remember how far back.
Right.
She'd been receiving mental health treatment as an outpatient for years. But there would be times when she would come to the clinic and she would be so agitated they'd have to call the police.
Mm-hmm.
Well, we enrolled her in the Fuse program, and immediately we were able to place her in a temporary hotel.
Mm-hmm.
But we really didn't know, is she really going to be able to do this? And the next day, the caseworker comes to her hotel room, knocks on the door. She opens the door, and she's clean, dressed like a woman for the first time in years, because one of her coping mechanisms was to dress like a man on the street.
Interesting.
Because she was afraid of
Right.
being assaulted, because she had been, and she'd been shot, and
Yeah.
she'd been gone through all these other things. Anyway, she's dressed like herself again.
Right.
Her room is neat as a pin, and the combination of just having the security and safety of a place to live has completely transformed her life. She's now reconnected with family. She's expecting a grandchild.
That's
I mean, we're replicating Fuse. There are other communities that have done this, not in Tennessee,
Okay.
but and we've read about it. But until you actually, get to experience it, it's kind of hard to believe
Yep.
what a miracle it is and
It
how
is.
simple it is to produce.
Well, looking hopefully forward to a little bit to the future, how long ago was it? You and I were on a very call early on with Barb Bowen about this whole thing. And I think it was Denver, right, that has a successful Fuse program already. Is it Denver? Am I
can't
confused?
Say,
I've
well,
slept since then.
Denver certainly is one of the communities.
Is there another one that you would point to say this is what hopefully it looks like in Chattanooga in a few years?
Well, Charlotte. We
Okay.
made a road trip to Charlotte to learn about their Fuse initiative.
Great.
And how that worked. But yeah, the data from all of these communities, because that's another thing that's different about Fuse, you have to have an independent evaluator track what happens to people after they're housed, and they also do a look back at the utilization prior to their being housed. So the LA example, they on average were spending $63,000 a year on people to be homeless. And once they were placed in permanent housing, that cost went down to $17,000 a year, including the cost of rent and support services.
I'm curious because I've talked to a lot of law enforcement in the last couple of months. Are you quantifying that? I mean, I'm thinking now about the impact on law enforcement. How many times the police have to come out and who are often ill-equipped to deal with the mentally ill, and so much of what we saw this summer had to do with that mismatch, right, in skill sets. So this has to have an impact there as well, right?
Police,
Yep.
court system,
Yep.
Emergency services,
Yeah.
crisis. We're not saying that once someone is housed, they don't have to then learn how to live with their mental illness, but at least they have a chance to be able to do that. And so over time, I mean, these Fuse initiatives are seeing housing stability success rates 80-90%.
That's amazing. That's
So
really amazing.
So you can't argue with the data.
Yeah. Well, so talk about this. We'll try to keep the wonkiness to a minimum, but talk about the data. What data do you track, and what are you looking for?
Okay, so I think first of all, the reason these people let me tell a quick story.
I might have been a management consultant in another life, so I'm particularly interested in this. I know this is right up your alley.
It really helps to have sort of a management consulting framework to a social problem.
Sure.
Because it forces you to be accountable for an outcome.
Quantify.
So,
Right.
Okay, so the first time we started thinking about replicating Fuse, we went down to the county jail just to see if our local jail had the same experience as others across the country. And so we asked the jail staff, well, do you have folks that come in here regularly who are homeless and mentally ill? And it was like, oh, of course we do.
Right.
And one staff member said, oh, you mean like Michael? He's been coming here as long as I have. And I said, well, how long have you worked here? And he said, 33 years.
Good God.
And so you're thinking, okay, so this problem has been going on for a long time, but until you put data around it, it's not visible.
Right.
And so we were able to, so where are we getting data from? Wherever these people have been. So in particular, we're interested in jail data because it'll help us reduce the jail population.
Sure.
And they shouldn't be there in the first place.
Sure.
We're also interested in hospital data. I can tell you that the same, I think I've got this right, the same lady I was talking about had 35 emergency department visits in the last 2 years.
Wow.
But until somebody sits down and goes to the trouble to collect the data, you can't see the problem.
Right.
And so data is key to Fuse. We will be looking at their utilization data prior to them being housed, and then we'll be able to track them over the next 5 years.
Amazing.
To see what happens. And we expect to see the same kind of dramatic declines in hospitalizations and jail time that every other Fuse community has experienced.
In my travels and discussions and research, I found myself wondering, this is not anywhere in our materials, so it's a bit of a flyer, but not really a hot potato. I found myself wondering why we don't have mental health emergency rooms. Has that concept ever come up?
Well, we do.
Well, they're just our emergency rooms, right?
And this is, the more we get into this, and it might be good to have someone from Volunteers Crisis Center, Crisis Stabilization Unit, pre-arrest diversion center. That's a piece of the puzzle.
Okay.
We do have that. I'm sure that for a lot of people that's enough. But for our folks, when they go back out on the streets, it's only a matter of time before they're going to cycle through again. I know a little bit about the crisis piece of it. With Fuse, we're all about landlords, housing units, and our special intensive level of support services, which is the ACT team.
Yeah. So just to get more mechanical about it, there's not like one Fuse place that they're not necessarily. Every patient in the program is not in the same place necessarily.
No. We will be. They have a right to live where they want, just like anyone else. Yeah. And so any landlord that is willing to take a voucher, is because these are going to be low to no income, and. The key for any landlord is the fact that we've got a 24/7, 365 support team that surrounds that person.
That's great.
And the landlord will have a specific person on that team that they can call anytime, day or night, to help make sure that the person remains stably housed and is a good tenant.
Right. Yeah, that's amazing. And the team itself, each person has. I guess a case manager, and I guess these are trained in these folks are trained in mental health.
Yep. It's the team. This assertive community treatment team is run by a mental health cooperative. It's a local behavioral health agency, but it doesn't work like regular case management. I'm trying to think of how to explain it. This is oversimplifying, but a regular case management might work with a person and find out everything that person needs and then do referrals to other organizations to help meet different things like, oh, this person needs housing, I need to send them over here. Yeah. Oh, this person needs substance abuse treatment, let me send them over here. This team it's multidisciplinary. It'll have mental health treatment people. It'll have employment specialists. It'll have housing specialists. It does exist. We are doing this. It'll have case managers, psychiatrists, and all the members of the team work with each client.
Yeah.
So it's a very holistic model.
Yeah.
And there's no other level of mental health treatment in our community that is available to people 24/7, 365. And the other thing about the team is they go to the person's home.
Yeah.
They don't.
Gotcha.
It's not a 9 to 5 come into the clinic.
Proactive, not reactive.
Yep.
Yeah,
and
sense,
so we've had some cases where, like the first person we got housed in 15 days. Unfortunately, it was in a not great neighborhood, and people broke into his apartment and stole stuff. Yeah. And the stress of that caused him to go to decompensate.
Right.
He needed to be hospitalized to get stabilized again. The team was there to manage it proactively, get him into a facility, and they were there when he came out so that he didn't go back to the streets, and we found another solution for him. So that's over and above what most case managers are funded to do.
For sure.
It's great.
Well, speaking of funding, you guys got some amazing needle in a haystack grade grants to do this, right? Can you talk about how it's funded?
Yes. First of all, a big part of our success is because we went out and asked for partnerships from Memorial, Erlanger, Blue Cross, Housing Authority, City of Chattanooga. Federal agencies look for those kind of collaborative partnerships. Right. But they didn't just say, yes, we're going to work on this with you. They also got out their checkbooks.
That's great.
We got some seed money locally. That in turn attracted local foundations. We even got some local donors. We've raised over, I think it's $1.2 million from the local community.
That's outstanding.
When you're able to then take that and say to federal partners, we have a real commitment in this community to doing this work, and here's the money to prove it. That made us very attractive, an attractive investment as far as federal funding partners are concerned. So,
absolutely.
So we got 2 federal grants, one for $3.4 million and one for $2.2 million. Both were highly competitive. We didn't expect to get both, and we did.
That's
and it's just a real blessing for us in this project.
And that will cover, 150 beds? Is that what you said?
It's 150 people, but and people say, how could you spend all that money on just 150 people? Well, part of these grants require us, say, the evaluation piece. That's going to cost us $800,000 over the next 5 years.
Okay.
There's certain staff that they require us to hire. So it's not all going to, provide support services and housing. In fact, HUD's going to cover the housing through housing vouchers. The support services piece, this ACT team, is TennCare covers it.
Okay.
But our grants will pay for people who are uninsured. And that's a real blessing because otherwise, people don't work for free. You got to have a way to pay the salaries of the
Well, in aggregate,
support
it's
team.
still a whole lot cheaper, surely, than all the wasted money, time, effort, grief, and heartache, involved in the without it. I mean,
we will be doing cost analysis. We're not just going to take LA's results and say, we're going to look at our own community and kind of see what the cost benefit is.
So it is a county program, which I find, it's another podcast talking about the differences between the philosophies of the city and the county.
Yep.
But to their credit, to Sheriff Hammond's and Jim Coppenger's credit, I mean, they've stepped up and it's remarkable, frankly. I find myself wondering, how could we expand this at the city? Or could we?
Oh, absolutely.
Or because the city's in the county, or should we just tell them thank you for your thanks for all your hard work and going down the road? I mean, are there things we could be doing to grow it at the city?
Absolutely.
Okay.
I think that, we keep talking about, we need more affordable housing. Mm-hmm. We do. But we need more supportive housing.
Gotcha.
We need more units. I mean, right now, we've got people with vouchers in hand that can't find a place to live. Mm-hmm. And especially units at the lowest income tier.
Right.
But we also need to, and this is something that the city and the county and others should work on. There are certain TennCare waivers or Medicaid waivers that our state could apply for that would help pay the cost to get people housed. It won't pay rent, but it'll pay deposits and So many states have this waiver.
Okay.
Tennessee needs one.
All right.
We just need to ask TennCare to do it.
Right.
But I would like to see us set a goal in our community of this is how many supportive housing units we need. And when I say supportive housing, I mean affordable, but also we can say, well, this is how many families need to be in supportive housing. So because...
Can you define supportive housing a little bit more clear?
I'll try.
Okay.
Because it's the housing piece is a subsidized unit with with a voucher or whatever. Mm-hmm. That's pretty set.
Yep.
But different populations need different levels of support. Not everybody needs a 24/7, 365 ACT team. Some families may need a little bit of support for a short amount of time, but support could mean, a case manager or some kind of specialist that works with them over a period of time. What we're missing is the money to pay for support services in a lot of cases.
Yeah.
And so if we had better customer information where we could say, here's our population, here's the different subsets of that population. Mm-hmm. This group needs a lot, this group needs a little bit. so that we could actually, begin to figure out how to target resources in an efficient way, then I think we could make a lot of progress. But we need a whole lot more supportive housing units.
Yeah, so the 10 care waiver thing is kind of interesting too. What would it take to make that happen? Is that a state level thing? Does that have to do with the federal Medicare waiver? Is it? Okay.
Yeah, it's and again, we're just learning about it, but I think we would just have to find the right people in 10 care and convince them to that this 1115 waiver, that's what one of them is called, would be a good thing for Tennessee, and ask them to do it.
Yeah, surely. That's I'll put that on the list of things to work on.
Please do, and we'll we're going to do everything we can, using data from our project, for example.
Well, and again, look, at the risk of stereotyping or categorizing unfairly, Republicans tend to be more business minded. We have a Republican governor, a Republican legislature, and they want to see quantification. There's nothing wrong with that, right?
Not at all.
Accountability and quantification, and I think we both know that the data will bear out the thesis.
That's right.
But I can understand where they'd want to see it. In Tennessee, I guess not just in cities, but particularly in cities. Surely that makes a world of sense.
I really think that a lot of times government's job is to fund programs, but it should never fund any program that it doesn't know the outcomes for. And so we're finding that that's more and more of a trend where people want data. Yep. So that'll be another challenge is figuring out, how do you find money for independent evaluation, for example?
Yeah.
How do you got to figure it out, though.
Well, that seems to be something that, if I were, I'm a localist at heart. I never want to have anything to do, very frankly, with federal government, but it does seem like something the federal government could do probably best from a management consulting standpoint, from an objective standpoint. Maybe I'm wrong and naive there, but perhaps.
I worked at the federal level.
Did you?
I worked for a time at the U.S. Interagency Council on Homelessness, which coordinates federal policy across the nation. But I think you can get more done at the local level, and and the key is to decide you're going to do it.
Yeah. Well,
somebody had to decide.
Intentionality is one of my favorite things.
Somebody had to decide we're going to do something about these frequent users or high utilizers in our community. Yep. So, and because the formula is out there, it just, we needed Sheriff Hammond's leadership to say, yes, go do this pilot, and that's all we needed.
That's wonderful. Well, it's a good segue because you, of all people, from the business side, from the government side, and for all the years you've worked on it, have arguably the best lens. Jens Christensen, who's coming up, next, would probably be the other one. It's not coincidental that you two are the ones here today, but you have a uniquely excellent lens on the program. Is there anything else that you see that's low-hanging fruit or even high-hanging fruit in terms of, things that we could be doing locally to address the homelessness problem?
Oh, goodness. I have a particular niche area, and this is the chronically homeless.
Yes.
And that's, I think that I really would like to see more data and more customer information. It's almost like, and I was thinking about you and the car industry. You know who wants to buy a Subaru versus who wants to buy a Cadillac. Very different people.
Right.
We don't really know all that much about, at least in a data way, about who's on our streets, why are they there, and what can we do to get them off. We really don't. We don't have the data needed to run the business, if you will.
Right. I see what you mean. I read something interesting the other day about which makes sense, right? But again, it's subjective. But this notion that homelessness at its core has to do with disconnection, right? People who are torn away from the normal support system of a social network, whether it's their families or, well, mainly family, I suppose. And I guess I've seen that pattern in just doing volunteer work around the community over the years. But how you quantify that and how you fix that is beyond my pay grade. I'm looking to find the smartest people I can to help fix the problem. But clearly, if it were simple, it would have already been fixed.
Right. So I think we've got an awful lot of people and organizations who are working their guts out to help, like, where are people going to sleep tonight?
Yeah.
I mean, there's so much of this that is emergency driven.
Yeah.
That who has the time and the capacity to think about beyond the emergency of the moment.
Hallelujah.
What's the solution?
Well, in all the years I've spent in the nonprofit world, I've spent a lot, 30 roughly. I mean, if you have a management consultant's mind, and when I went back to business school late in life, they're like, hey, if you ever get out of business, this is what you should do. And I had a great enthusiasm for it. So I admire your field of work, and but you become a systems thinker, right? Mm-hmm. And you're thinking about systems and process, and how do you go back upstream and correct the flow chart, right? How do you not in a reactive sense, but in a proactive sense? How do you fix the system itself? And I find myself applying that rubric to everything pretty much. So I agree, right? Homelessness is one of those that we've got to get from playing whack-a-mole to what are the root causes and how do we address them? So that's I'm glad we have people like you in it, and I hope you always stay in it because I think the Fuse. Thank you for coming today. I mean, the Fuse program is super exciting, and hopefully it will. I think it already is clearly making a significant dent in the problem locally.
Well, thank you. Thanks for letting me talk about it.
No, not at all.
We're really excited about what we're going to do over the next 5 years. So
and so that's the scope of the program. 5 years.
The pilot.
Yeah, okay.
It will continue beyond 5 years, but that's the amount of time we have to really, look and see what's under the hood of the system. What are the barriers and breakdowns that created this frequent user phenomenon to begin with? Right. What are the barriers that are getting in our way to help them? And we're already finding those. And to be able to elevate those so that make them visible so they can be fixed.
Mm-hmm. Precisely.
As long as we're not willing to talk about what's not working, we can't fix it.
That's right. Yeah. Yeah, and the last thing you want to do is get caught up and lose sight of outcome and wind up perpetuating the problem or just sort of spinning the wheel. Absolutely right. Well, is there anything else you'd like people out there to know about the program? Or, I don't know if there's a way for people to get involved, learn more, anything else you want to share with the audience?
Well, we will have a website coming soon, but I would just say if there's anybody out there who has a family member that they're worried about or think, someone who might have a severe and persistent mental illness diagnosis, might be out on the streets, might have a history of incarceration, they should call Mental Health Cooperative and say that they want to connect with someone to talk about Fuse.
How do they do that? Is there a number? Is it an 800
I wish
number?
I knew the number off the top of my head.
Mental Health
it's
Cooperative.
Mental Health Cooperative.
Okay.
They have a local, I believe, a local number here.
And just not to belabor the point, but if I dial 911, do they know that? Do they know how to?
Probably not yet. But you wouldn't necessarily call 911. Fuse is what you want to connect with after the emergency.
Right.
But yeah, the hospitals, we've been making the rounds.
Good.
Of course, they're our partners.
Sure.
They know about it. Certainly Moccasin Bend knows about it. Homeless Healthcare. We're getting out there and spreading the word that we're taking people and looking for referrals.
Good public policy has a part to play in this, clearly, and good public communication. So I wish you the best, and God bless you for doing what you're doing. This is a hugely important piece of work, and I look forward to helping in any way that I can.
Well, thank you. It really is an honor to be able to do this work, and I'm just glad that that you're interested in the topic of homelessness, and I hope all mayoral candidates will make that a priority.
If they're not, they should, because there's one topic that's come up in my discussions and making the rounds that has really risen. I mean, obviously in the time of COVID, it's the economic consequences are as severe, or arguably nearly as severe as the public health consequences, and it's a real problem, right? And so Jens will be coming up next to talk about a different perspective on it, but yeah, I mean, there's nothing more pressing that we could be discussing. So, thank you very much for coming, Janna, and thanks to the audience for tuning in. Feel free to chime in with any feedback, and if there's anything in particular you'd like us to talk about, please let us know, and we'll consider it for a future topic. I'd also like to thank Summer Dreggs, a local artist, for contributing his music to the podcast, and OCI for contributing our sturdy furniture. You've been watching Common Purpose. I'm Tim Kelly. Stay healthy, stay hopeful, Chattanooga.
You my little baby homie, and I love it that you know me so much better than the old me. Maybe it's cliche to say